Good morning. So this will be the first session, the introductory session, when we would like to understand the general picture, who is vaping and what people are vaping, what type of products, and understand the consumer perceptions and the groups of different consumers. So our first speaker will be Spike Babaian. She is a former adjunct professor at Mercy College in New York City. In 2009, Spike founded National Vapers Club, the first consumer group for e-cigarette users. She co-authored the first peer-reviewed paper in the US on vapor toxicity, and in 2011 opened at Vape New York, an e-cigarette retail shop that has grown to 3 locations and has day-to-day contact with thousands of vapers product consumers. Yes.
How are you? My name is Spike. I've been intimidated by many of the people in the e-cigarette industry doing research, but then I realized that I've been doing this longer. So I probably know just a little bit more about the use and the product, and I'm hoping that I can enlighten you about the product so that way we can get all the research that we need to educate the public and our academia. I had a couple areas that I don't have a whole lot of information on. So some of them I'll skip through quickly, but these are some of the areas that I feel are most important areas for research, and each of them is covered in a slide. I had discussed years ago, actually, with Mashej about flavorings and what flavorings may or may not do to the lungs. And there was some concern about different flavors. Most of these concerns have been studied, but only a little bit. Cinnamon creates cinnamaldehyde. There's been concern about respiratory irritation with it and potential toxicology. But the quantities of cinnamon, citrus, diacetyl, we all hear a lot about diacetyl and the possibilities of popcorn lung, and even oils in the e-cigarette liquids, in the e-liquids. And these are things that obviously our industry is very concerned about. But up till now, we haven't seen any ill effects from these flavorings. However, it's important to study them before it gets to that point. So it would be nice if we can get a little bit more data on what level, what concentrations of these flavorings is considered to be toxic for inhalation, because most of these flavors have only been studied for ingestion and not for inhalation. That's why this industry is so different than anything else, because it's never really been done this way before. Medications that are inhalable have vegetable glycerin, propylene glycol, but not necessarily flavorings. A number of studies that came out showed formaldehyde formation and, extreme toxicity of the vapor, and said, oh, this vapor has toxic levels of this, 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 and this. The problem is that most of those studies were done by a machine. The study that I did was also done by a machine. But as a user, I was able to put together an e-cigarette so that it would not be used incorrectly, because I had used them, so I knew how to. One of the things that I strongly encourage people to do is, if you are doing research, if you are doing a study, find someone who uses the product and bring them in to consult on how to set up the experiment if you're using a machine. Because a machine can't tell that it's not something that you can inhale. A human being can. Obviously, you can see the face here. If you Google dry hit and vape, you will see dozens and dozens of pictures with little memes like that that show you that it is physically uncomfortable, like extremely uncomfortable, to take an inhale off of an e-cigarette that's not wicking properly, that's not wet enough. But consumers don't always know that they have to keep the tank filled or that they need to make sure that the temperature is not set too high until they take that first puff. After they do it once, they will never do it again, and then they learn. So battery safety and education has come up a lot lately, with a lot of batteries exploding or e-cigarettes exploding, because the news always says an e-cigarette exploded. It never says a battery exploded. And yes, sometimes an e-cigarette did explode, but more of the time a battery exploded. Batteries that are removable from the device, whether it be a cell phone or a laptop or an e-cigarette, come in lots of different shapes and sizes. This is similar to the one in the picture, and you can see that there's metal on both ends of it. If you take this and you put it in your pocket with your keys, or metal, or change, or paper clip, and it touches both sides, the battery energy goes back in on itself and causes the battery to explode. This is definitely dangerous. It's mind-blowing to me that consumers don't know that yet, but there's a lot of risk. There's also other ways that e-cigarettes explode. When we have consumers come into our shop, we provide them with a risk agreement that has a little checklist, and as we go over it with them, they check off each one. Do not put batteries loose in your pocket. Do not turn your settings up past this. Do not use this top on this bottom. Do not put 2 batteries in a device that's supposed to have 1 battery. There's a list of 15 or 20 things, and we educate our consumers. Because of that, after 6 years in business, we've never had a consumer explode a battery. It's a very simple thing to do, but unfortunately, e-cigarettes are now being sold in supermarkets and convenience stores and bodegas where you don't have anybody who knows anything about the product, and they're not able to explain it to the consumers. And that's a problem. The e-cigarettes should come with instructions. Oftentimes they do, but they don't always warn about these things. These are very important. One of the big concerns of our industry is that deeming regulations have put a stop clock on us, and we cannot advance the products any further. One of the ways that we can prevent battery explosion is by building safety features into the e-cigarettes. Most of them have them, but some of them do not. And unfortunately, the FDA deeming regulations have put a stop and said we cannot make any modifications to the products that are being sold right now. This is a problem. Some of them need modifications because they need to have safety features built in. Consumer Product Safety Commission could very easily look at e-cigarettes and determine what safety features need to be built in or whether or not they should be sold, whether they're safe products. This needs to be done, and it needs to be done fairly quickly. We've heard of maybe half a dozen cases of e-cigarette explosion. There are multi-millions of e-cigarettes that have been sold in the United States in the past dozen years, let's say 10 years. And we've heard of 6 of them exploding. So it's not a huge issue, but it is an issue that needs to be addressed quickly. Another concern that we have is DIY and black market risks. Almost every survey of e-cigarette consumers has said that if the e-liquid was banned or became unavailable, that they would make their own. This is a problem. We cannot have people who do not have chemistry degrees, who have no experience mixing, toxic chemicals at high concentrations, mixing it in their home or their bathroom. Number one, there's not a clean environment to mix liquid in, and number two, some of the nicotine is at toxic levels. The other ingredients are not toxic, but nicotine is. People are going to mix it without eye gear, without using proper precautions, without using gloves around their children and their pets, and this is not safe. They're going to be using unregulated, untested liquids, and then we're going to see a lot of health issues because you're going to have people using liquid that's made in their house. That's not okay. So a big concern of ours is taxation and extreme regulations that prohibit people from having easy access to e-liquid. People are already, millions and millions and millions of people are using e-cigarettes. They need to have access to liquid that's safe, clean, and regulated. The materials for e-cigarettes, this was not really addressed, so it was addressed in the deeming regulations, but not sufficiently enough. People are using copper and brass and wood in e-cigarettes. Wood is porous, it holds bacteria. Copper and brass, oxidize to form all sorts of chemical particles that you wouldn't want in your lungs. Unfortunately, these pieces are parts that come into contact with liquid, e-liquid, frequently. So they do corrode, they do tarnish, and some of the e-cigarette users call it, oh, it's patinaed. Well, that's nice, but it's going in your lungs, and that's not good. So certain metals need to be restricted from use in the products where they contact the liquids. It's different when it's in the device that you're holding in your hand than when you have a part of the e-cigarette that's contacting the liquid daily and it's getting corroded. It's not okay. Limitations should be set on the types of metals that can be used in an e-cigarette. I am sure that a lot of people here are going to bring up youth uptake of e-cigarettes, and so my slide was not put together properly. I've had a very long week, so I apologize. But a new study that came out shows e-cigarettes are a gateway to smoking. I have a little comment in there that was actually from a blog from Michael Siegel, Boston University School of Public Health. He noted about the study that just came out. Among the group of new smokers at follow-up who had recently vaped at baseline, all reported that they had smoked cigarettes at the level of once or twice in the past 12 months at follow-up. He said, there's another way of saying this. The other way of saying it is, among the group of new smokers at follow-up who had recently vaped at baseline, not a single one had smoked more than 1 or 2 cigarettes in an entire year. So maybe we need to look at the way that we're writing the research and the way that the media is portraying the research. I'm not blaming the researchers, I'm blaming the media, because they like to blow things up and make it seem all dramatic so that they can get more viewers on television, and that's nice. But in reality, we need to be careful how we portray the research and how we explain it, because all of the facts need to be there. And in reality, that's a good thing. I do have a note on here that says youth vaping may be preventing initiation of smoking. Nobody wants to hear that. Nobody wants to hear vaping is good. Okay, well, vaping is good. If I have my own child, I do not, by the way, but if I have my own child and my child is 15 years old and my child is smoking cigarettes, I am going to give my child an e-cigarette if it means that they won't smoke cigarettes anymore. And you can deny it, but I'm willing to say that almost everyone in this room, knowing what they know about e-cigarettes, would say the same. Vaping during pregnancy. One of the biggest risks of smoking during pregnancy is carbon monoxide, taking oxygen out of the blood. Obviously, there's risk to nicotine. You don't want your fetus to become born addicted to nicotine, and that's definitely a risk. But having carbon monoxide in your blood is definitely worse. OBGYNs, or they usually use midwives. Apparently in the UK, I did not know this, but I've been reading up on it. The UK has a very different, obviously, view on this, on e-cigarettes than we do. They've said it's a medical device, they've said it's harm reduction, they've said it can be used to quit smoking. We're not allowed to do that in the United States unless we prove that it works for that. But in the UK, they've said vaping is very likely to be less harmful to your baby, and if the alternative would be smoking tobacco, then we'd rather that you vape. In America, we say vaping is toxic. Flavors, they actually said on the CDC website, flavorings in e-cigarettes may be harmful to your baby. There's no evidence of this. I'm not sure. If there is, I'd love to see it, and I would hope somebody would email it to me and say, you're wrong. There's evidence that inhaling cinnamon flavor can be toxic to fetal brain development. But they're saying things to frighten people away from e-cigarettes, and then these people are smoking cigarettes while they're pregnant. I do hope that somebody will do a study. There are at least a couple that I've heard of. Women are very particular about not letting people know they're vaping while they're pregnant, but I do know of at least a couple of women who vaped through their pregnancies and had perfectly happy, healthy, stable weight children. Just to bring the point is that the difference between the UK and the US is huge, and I think that it's important for us to be aware of these differences and maybe rethink why we're thinking so differently. Effect on non-users. This is obviously a concern. We don't want non-users picking up e-cigarettes. We don't want people becoming addicted to nicotine who have never used nicotine. The volume of nicotine in e-liquid is typically less than 1%. Usually the average is 0.3% by volume of nicotine. And when you have vapor coming out of a user, they're absorbing some of the nicotine, we hope, otherwise we wouldn't be using it. So the vapor that's coming out, we hope, has less nicotine. When you exhale e-cigarette vapor, it's sticky. It doesn't float the way that cigarette smoke floats, it sinks. And it has more likelihood to stick, which, as a side note, anyone doing research with machines, please be aware that the nicotine vapor sticks to the sides of the tubing if you're using machines, and please clean the tubes in between trials. So because the behavior is different, there are questions. Does the vapor stay around longer than the smoke does? Does it stick longer than the smoke does? But we have to remember that when you test vapor, and almost every study, actually not almost, every study that I've seen that tests vapor toxicity shows magnitudes of order lower levels of TSNAs than in cigarette smoke. So if our concern with third-hand vapor is that people around us may get carcinogenic toxins in them from touching a chair in the room, well, if the levels are that much lower, what is the real risk? So I hope that somebody will do research on this and assess dermal absorption of nicotine and TSNAs as separate products from third-hand vapor exposure, because it's unrealistic to think we should be walking around saying, don't touch a chair, someone vaped in this room 3 hours ago and you might die. People are thinking that from what they're reading from some of the people that are making statements that are outrageous. My suggestions for future research: based on being a consumer and a retailer of this product and having experience with many, many people, consumers using tobacco and menthol flavors seem to me to be more likely to return to tobacco than people using flavors that are not tobacco and menthol. I think this is something that someone should look at and study, because I think that maybe being reminded of tobacco and menthol is what is making them want to go back to smoking. It also may be that people who use tobacco and menthol are newer users and therefore more likely to return to smoking, but I'd like to know why. Consumers with support for using the product seem less likely to return to combustible tobacco. So people who have learned how to use it properly, who have proper education, who can go in and say, this isn't working, can you help me fix it? These people seem to be more likely to stay with the product than people who purchase online and have no way to get help. People with the availability to try different products before they buy one, so who have tried a number of different products and find the correct product for them on the first try, seem to be more likely to be successful at entire substitution. Using the correct nicotine levels, many times we see people come into the shop who are using 0.3%, which is average with an advanced level device, but they're using 0.3% nicotine with a first-generation device, and they can't understand why they're still smoking 5 cigarettes a day. They were smoking a pack, but they're still smoking 5 cigarettes a day, and all their friends use this and don't smoke anymore, so why can't they not smoke? Well, because they're using the wrong level of nicotine. This is important to educate shop owners and industry people on what nicotine level and with what product, with what generation product is important to give to somebody. I know that we're not using this as a quit smoking device or an NRT, but in reality, if it's working for that with the right nicotine level, shouldn't we at least be trying to get people the right nicotine level? Another question was, is it the nicotine addiction that keeps people using the product, or is it the behavioral aspect? We found that most people, and after 6 years selling them, that was my warning that I'm almost done. Thank you. So after 6 years selling them, we've seen that almost everyone that uses the product drops their nicotine level, even with the same device. So using the same device over time, they're still dropping their nicotine level, which means maybe it's not all about the nicotine, maybe it's about the behavioral puffing. So I'd like to see some behavioral psychologists doing some work on that. And the last one is about the last slide, assessing the rate of dermal absorption of TSNAs and nicotine as separate products from third-hand exposure to vapor. This slide is my last slide, and there's a reason for it. I've said it many times, and I like to say it in a room full of people that have educated minds, because then they're able to process the information I'm saying. A lot of times people don't really understand. When you offer someone an apple, and the apple looks good and tasty and shiny, and you say there's a 50-50 chance you're gonna die eventually from eating this apple, 99.999% of us would say, I don't want the apple, thank you very much, I'll just wait and have something else to eat later. But when you give a pack of cigarettes, which people have to actively go out and seek and buy and pay for, that has a warning on the side that says, there's a very good chance that you're gonna die from smoking these cigarettes, people continue to do it. There's a reason why the smoking level has not dropped below 17% or whatever it's at now, and why it doesn't drop. Some people's bodies, the benefit of the nicotine outweighs the risk of a 50-50 chance of dying from a smoking-related illness. I mean, think about that idea for a moment. People are willing to die to have nicotine in their system. That is how important it is to them, because of their continued functioning and because of their quality of life with the nicotine. So it's important to realize that although e-cigarettes have some risk, need to be regulated, and all of these areas of research need to be learned about, you cannot say to people, be nicotine-free. There's a big difference between saying be smoke-free and be nicotine-free. And I think that it's time for academia to wake up and realize that. Thank you very much.